Health Talk here on AM 1270 and 96.5 FM. I'm Paul Thomas, and in the studio with us today is Bill Kearney of Northlake Medical Pharmacies. And Bill, we both have survived Halloween, it looks like, and now moving into the holidays. And I put that in quotes because that's, kind of the...
Now we're going to gain some weight from the Halloween
yeah.
candy and the Thanksgiving candy and
Christmas well,
candy.
They say, I read an article that says, for kids and Halloween candy, you would think that they would say, oh, don't let them eat too much. But the article actually says to let them eat as much as they want to begin with, and then they kind of lose that, desire for it, and will end up eating less, and it's more healthier for them to eat it all at once and not, spread it out over months and months. Matthew and I started counting last night, and I counted a pile of 100 pieces of candy, and there was still a lot more. I figure he probably got 300 pieces of candy last night.
And that was probably including little candy bars. And
oh, yeah, all that stuff. And, it's kind of funny, though. I was actually noticing back when I was a kid, I seem to remember a lot more candy bars, chocolate bars, and nowadays it seems like it's more of the just straight sugar stuff, like the taffy and the sweet tarts and the hard sugar candies. I don't know if that's because they're cheaper.
Well, I think that's I think that's where kids are going today. They love that. We were talking about that. I was in Salt Lake City on the weekend and with part of a family, and all their grandkids were talking about sweet tarts, and half the grandparents and mothers and fathers didn't even know what they were talking about. But they weren't looking for chocolate. They were looking for that sweet sugar stuff.
Sweet sugar stuff, yeah.
And boy, they had it. I mean, they were going every direction you could think of. But
and Matthew, he doesn't even really like chocolate. He's like he doesn't like chocolate chip cookies. He doesn't like chocolate candy bars.
Really?
Yeah, he doesn't like chocolate. He's a very picky eater to begin with, but for whatever reason, he's not a fan of chocolate.
And I think one of the reasons is those, candy bars now. For a big candy bar, it's $1.50 or something.
Yeah.
And when you have, we have hardly any trick-or-treaters where we live, but like you were talking about going down 20th Street and Hartley, and those areas are packed with. I think every kid in Lake County knows that.
It's pretty crazy down there. There's a lot of action going on. And what I don't understand, maybe it's because 20th Street's kind of a main, drag for streets and getting into the back areas, but they don't close the street off. So it's kind of stressful because not only do you have all the kids and the parents and everybody running around on the narrow sidewalks, but you got traffic going up and down the street too that you got to contend with.
Right.
One street over on 19th Street, they actually closed the street off, which I think is a good idea, a better idea, and then at least you can kind of, you're not worried about the traffic element. But 20th Street, boy, I tell you. I don't know if we'll be going back there again after this year. We went because Matthew wanted to go with some friends, but I don't think next year we might just let him go.
It's quite an experience.
It is.
Well, ironically, we're going to be talking about your health, and anytime I travel, people question me that haven't seen me for a long time about this medication and that medication and what they're doing and what they should take this and whether the doctor was right, and they say I'm in great shape, but my A1C is 9.2 or whatever. So one of the things that one of our relatives was talking about was blood clots, and this is a kid that's 50 years old and quite a good physical specimen, and he gets blood clots. So he's on Coumadin, which is to lower the blood clots, and he doesn't like going in for Protimes and INRs. By the way, our number is 263-5252. If you have any questions about your health or anything you'd want to talk to us about, we're here at 263-5252. And so they wanted to put him on a drug called Eliquis. Well, Eliquis, the copay on that drug is like $150 with his insurance company. And so he wanted to check with me about it. Well, one of the things about these non-warfarin type blood clotting drugs is they can cause bleeding and there's no way to stop that bleeding. With warfarin or Coumadin, you know you can change the dosage, and if your INR or ProTime is too high and you need it lowered, then you can change the dosage of the medication, and the doctor tells you how to do that. And if the doctor doesn't tell you that, you call them up and they will give you a schedule on how to get that down. So I went over everything with my cousin, and I said, you know, if it were me, of course I'm much older than you, but I would rather stick with the warfarin and get a blood test every week, and know that if anything happened, that I would be able to counteract that with increasing or decreasing my dosage of warfarin, where you can't do that with this drug Eliquis. And there's a lot of those drugs on the market that are options, and their big selling point is that you don't need to do a ProTime, you don't need an INR, so you don't need to go in every week or every month or every 2 weeks and have a blood test. But we always talk about risk versus benefit. In those cases, I left it up to him. I said, you need to do whatever you need to do to make your life so you survive, number one, because this kid's a real John Wayner. He's a big guy and works out all the time and hates being hampered by having to have blood tests. So we'll see where that goes. But those are the kind of questions that we face. And another one that came up that I thought I would share with people is, you're getting all kinds of messages now about statin therapy. And physicians saying that if you're over the age of 70, you don't need to take a statin anymore. It doesn't do any good. And then you'll have a cardiologist that overrides that. And I had a patient in yesterday who had 2 different statins, and the primary care physician had taken him off a simvastatin, and then he'd gone to his cardiologist in the last couple of days, and the cardiologist put him on a atorvastatin. So he had one from one physician, one from another physician, and I was trying to give him a consult, and he had both drugs. And I said, you shouldn't be taking both of these drugs. And he said, well, I just went to my cardiologist, and he prescribed the statin. So I'm not going to tell a doctor that that the standard of practice now is not to prescribe the statin. In fact, patients will probably need our help in discovering whether or not to listen to this conflicting information online about the risks and benefits. About 50% of the people taking statins now stop it within a year, and that's probably not advisable, because if patients who could benefit from a statin, it's hard for me to tell you that a 70 years old, if you have a cholesterol problem, a LDL or a HDL problem, that a statin is not going to help you. And I was telling this individual that in our job in managing medication for you through the insurance companies, it's a quality measure for the star ratings, and that's how we get paid. So the insurance company says to us, you have a diabetic person or a person that's 70 years older, that the clinical data says that they support that person being on a statin. Even if they don't have a cholesterol problem, they suggest a pharmacist contacting the physician and getting a statin prescribed for those. And we've had physicians turn us down. And in some states, they're considering regulations to allow pharmacists to prescribe the statins for diabetic patients. We would never do that if a physician said, I don't want them to be on it. But patients that are taking a statin for about 5 years prevents about 1 in every 20 patients with cardiovascular disease from having a stroke or heart attack, and 1 in every 50 high-risk patients without cardiovascular disease. So the higher the risk, the greater the potential benefit, even if the cholesterol isn't elevated. So here's an answer to what I just said. If the cholesterol isn't elevated and you're a diabetic and they put you on a statin medication, you have a greater potential to not have a cardiovascular risk, even if you don't have high cholesterol. And it actually, to put it in perspective, the statins' cardiovascular benefits outweigh any small diabetes risk, because that's the other thing I was told. And I know this is in the literature, that it could cause you to have diabetes. But liver disease linked to statins, very rare. Statins don't cause dementia or cancer. When we first started putting people on statins, after the first 30 days, we would take a liver panel to see a liver function test. And then we would do it after 6 months, and then we would do it after a year. And then every year, we would do a liver function test called an LFT and find out if there was any cardiovascular problems or any cholesterol problems or liver problems. And what would happen in those cases is 99% of the time there wouldn't be any liver functioning problems. So it got to where we were just renewing a statin without doing any LFTs, liver function tests. And if we got some information that said we may have a liver functioning problem, meaning a jaundice type appearance, the skin turning yellow, or we had some muscular problems, which is muscle pain is one of the side effects of taking statins. But if you have the muscle pain, it's rarely harmful, and fewer than 1 in 23,000 statin patients will have that rhabdomyolysis, which is the muscle symptoms. One way you can tell if it's involved, the statin's involved in causing that pain, you stop taking it for 2 or 3 days, and if the muscle pain goes away, it was related to the statin. And using non-statins to take the place who people can't take a statin, they don't get the same result from those. There's no proof that improves cardiovascular outcomes when you're taking some of these other drugs, and that non-statins like niacin and fibrates and bile acid sequestrants don't improve the cardiovascular outcomes when added to a statin. And, you know, as much as we'd like to believe it, and as much as we see on television, fish oil supplements haven't been clearly shown to reduce the cardiovascular events. A red yeast rice isn't safer than a statin. Fermenting the rice produces lovastatin and similar compounds. Again, it's this risk versus benefit. And as I was telling people when I was at in Salt Lake City, you have to take control of your life. You need to know what medication you're taking. You need to know why you're taking it. And this gentleman that was prescribed 2 statins, one by one physician and one by another, that's a very serious matter. If he didn't have a liver function problem taking one, taking 2 increases the possibility of that by a strong percentage. So just want to remind you that there isn't a right way and there isn't a wrong way. And if your opinion varies from one doctor to another, I would get a blood test and just see where we're going on that. And if it seems like you're in compliance and your enzymes are where they should be, then I would say just go ahead and not take it. But I wouldn't want you to make that decision on your own. And I certainly wouldn't want you to have a heart attack or a stroke because of it. We had a flu clinic at Northlake Medical Pharmacy at Bruno's last week. We did 20 or 30 immunizations in a short amount of time. We are going to have another flu clinic at the Hill Road store. I think it's from 12 to 2 on the November the 9th. And it's only going to be at Hill Road. It's not going to be at the Bruno's location. We still have 2 strong months to give flu vaccines, and there has been a really rapid increase in the amount of people getting flu vaccines. So we want to make sure that you take advantage of that opportunity. You can get the shots anytime. You can come into either one of our pharmacies and get the flu vaccine without an appointment. Just fill out a document and we'll give you your shot and you'll be on your way. If it's covered on insurance, there's no charge. If it's Medicare, there's no charge. If there's Medicaid or Medi-Cal or Partnership Health, there's no charge. So we want to remind you that we're just going to be entering the flu season. I think we're going to having some rain again. Are we, Paul? You're the weatherman.
Supposed to be this weekend, possibly as early as Friday night.
And then I saw in the extended forecast that we're supposed to get it a week from now again.
Oh, I didn't see that in the. I know it's supposed to be colder than normal next week, but
well, it's going to be in the 50s here.
Yeah,
that's going to be the high.
Yeah.
So those influx of temperatures and people staying inside and doing what I did last weekend, flying to another part of the country, being on an airplane, everybody around me was coughing and snorting and sneezing, and I'm sitting here with broken ribs twice now. And suppressing every kind of sneeze and cough that I can because the scream that I would let out would be much greater. But being in those kind of situations, the other thing is if you're over 60, and a year ago and 2 years ago we gave you Prevnar 13, which was the new pneumonia vaccine that came out. And whether or not you'd had the Pneumovax 23 or not. So we told many of you a year from now, get the Pneumovax 23. So if you've only had one shot and it was within the last 2 years, you need to come in and get the second one, which is the Pneumovax 23, if you're over the age of 60. That's really important, especially if you have a weakness to have pneumonia. It is imperative that you follow up on that. We will ask you if you come in and fill out a questionnaire for flu vaccine, whether you've had pneumonia or not, or you've had an immunization for pneumonia. So the first one that people got many years ago and up until 2 years ago was Pneumovax 23. If your first shot was in the last 2 years and you got Prevnar 13, then you need to get another pneumonia shot. So if you come to us, we will have it on file. If not, we'll try to trace down your medical record and see everything that's supposed to be on a computer system. And that started a year ago. It still isn't up. It was supposed to come up today. So there's a chance we could check it through that. If not, we'll do our best. But and you being a historian of your medical treatment will help us immensely too. And then if you've had a new baby into your life in the next, or you're going to have over the next 2 or 3 months, you need to get a Tdap shot because of the whooping cough. Now this is tetanus, whooping cough, and tuberculosis. So it's 3 things in one. But if you're going to be around a small child, an infant, then you need to, during the holidays, then you need to get a Tdap shot. We talked briefly last week about the new shingles shot. And I keep getting information on it, and a federal panel recommended a week ago today that people already vaccinated for shingles get a new, better shot. And the advisory group just approved the vaccine made by GlaxoSmithKline and works better at preventing shingles and may last longer than ones that have been sold since 2006. And we're talking about shingles, and it's a painful condition that causes blisters. If you've watched advertisements on television and you see this guy with these big blisters all over his back, it's when the chicken pox virus resurfaces years and years later. Often when people are in their 60s or older, about 1 in 3 United States residents will get it during their lifetime. At the meeting in Atlanta, the Advisory Committee on Immunization Practices said the doctors should first opt for Glaxo's 2-dose Shingrix, which uses a new ingredient to boost its effectiveness, and it was approved in the United States last week, and the committee recommended it for adults 50 and older. Now, this has been shown to be 90% effective, and at least at last 4 years. It performs in very superior fashion and will prevent more disease than any other vaccine. The vote wasn't that great. The vote was 8-7 that the 2 vaccines had not been tested head-to-head yet, where they were doing a double-blind test, and one was getting the Zostavax and one was getting the Shingrix. It would take years to do that. Some wanted to wait for a more long-term safety program. But other panel members worried that without citing a preference, many doctors and pharmacies would decide to stock the less expensive vaccine, which costs us $232, and the other one costs us $280. Merck's vaccine is recommended for people 60 and older. It reduces their risk by about half. I think the recent figures are 67%. Most of you, like myself, got it when it first came out and were wondering whether we should take a booster shot. And Merck, the manufacturers of Zostavax, says, no, you don't need a booster shot. This panel didn't suggest a time frame when it would recommend the new vaccine over anyone previously vaccinated, and it said as many as 20 million Americans would be eligible for a second round. In spite of the threat, it hasn't been a very popular vaccine, the Zostavax. Only about 30% of those people over 60 got it. But let me tell you why. That's a very expensive vaccine. Most insurances don't pay for it. Every once in a while we'll find a Medicare D plan that pays for it, but most of them don't. And if you've never been around anybody that had shingles, you don't think of how painful this can be. I've had people that were diagnosed with terminal cancer that had got shingles from the stress of the chemotherapy, and the cancer was cured, and they still had this pain and these open sores where the nerve endings are exposed to the skin. So in a statement that Merck officials said they hoped that the agency would consider some of the issues raised at the meeting and not give a preferential recommendation to Shingrix. But they themselves said that it wasn't effective for that long a period of time, and they told me on the phone at Merck headquarters that they had not done due diligence as far as having a booster vaccine and suggested not getting it. So again, it's risk versus benefit, and we're not going to give a booster shot if the people that manufacture it say don't give it. So we'll see where that goes. You know, questions are coming out whether it's okay for patients to switch antiplatelet meds after a coronary stent. And that's when they go in and put a stent to open up the blood vessel. Current guidelines prefer the combination of aspirin plus Brilinta or Effient after an acute coronary syndrome instead of the aspirin plus clopidogrel. And because they said they may cause more bleeding and cost a lot more, there's a growing evidence of switching people to clopidogrel, which is Plavix, as soon as a week after placing a coronary stent leads to a similar outcome with Brilinta or Effient with less bleeding. So it's likely most patients are now getting the newer drug-eluting stents that are less likely to clot. but you will start to see people or talk to people, if you've had a stent, that are switching to Plavix or clopidogrel, especially to lower the bleeding risk or reduce costs. It's kind of what we were talking about Eliquis and warfarin. And when they first started using these stents, they did that with Plavix or clopidogrel and aspirin. After you switch and ensure that the previous antiplatelet is stopped, and patients understand to continue with aspirin with their new antiplatelet, most patients get this therapy for 6 to 12 months and then just take aspirin indefinitely. And that's exactly what happened in the very beginning. After they did the stent, they put them on Plavix and aspirin, and they were going to do that, and were told to do that for a period of 1 to 3 months. They ended up extending that to 6 months, and then many of them did it a year and then putting on aspirin, and a lot of people, because they didn't want to have the liability risk, have left them on the dual combination. Adherence to these meds, especially soon after a stent when the risk is the highest, is very important. So in the bottom summary or conclusion of this, the clopidogrel, which is the Plavix, and the aspirin causes less bleeding than the other two drugs and definitely has the lowest cost. So make sure you check with your physician or your cardiologist who did the stent, and make sure you're at the lower risk possible and the lowest cost possible. What many physicians don't understand is how expensive it is to treat with these drugs. And you say, well, get a prior authorization. You're going to get a prior authorization, but your copay is going to be quite high. Now, many of you are going to in open enrollment in Obamacare, which is not Medicare, and many of you have enrollment till December 7th in your Medicare D plans. You need to check these plans completely, their copay, their formulary, what drugs you take, what drugs are in the formulary, what drugs aren't in the formulary, and if you happen to have one of these drugs that was not in the formulary and you have to pay for it, there's a great chance that you're going to be in the donut hole way before you would be otherwise. And people are just now finding out what the donut hole is after you've spent about $4,000 on your drugs, including what the insurance company has paid. Then you have to go in the donut hole where you're paying about 50% of the cost of the drug, and that becomes really expensive. We had a person come in the other day that was paying $400 for a drug that he had a $5 copay on before. So we're going to take a break, and when we come back, we're going to talk about the fire and some of the things you need to be cautious about, and non-steroidal anti-inflammatories. Have you been to the pharmacy recently where the employees know your name when you walk in the door and have your prescription refill waiting? If you answer no, then you probably haven't been to one of the Northlake Medical Pharmacies. Hi, my name is Bill Kearney, owner of Northlake Medical Pharmacies. For 38 years, my wife Dana, our daughter Brandy, and our employees have been dedicated to giving you the best service we have when you come to get your prescriptions. We are a family-owned pharmacy, and our employees are members of the Northlake Medical Pharmacies family. We know you have a choice when you get your prescriptions filled, and we appreciate you making us your choice. You see, you are part of our family too. We truly care about your health and taking care of you when you aren't feeling well. We deliver your prescriptions free when we know ahead of time and do the best we can to take care of you and your family. Northlake Medical Pharmacies with 2 locations for you, on Hill Road across from Sutter Lakeside Hospital and 347 Lakeport Boulevard outside the Bruno Shop Smart in Lakeport.
I loved playing high school sports. I loved the competition, the camaraderie, the bands, the crowds, all the pageantry, and I wanted to keep playing. But I graduated. No colleges called, and neither did the pros. So, to stay close to the game I loved, I decided to become a high school official. You know, a referee. When I played high school sports, I learned the importance of integrity, good sportsmanship, and respect for the rules. Now, as a high school official, I get to help model these same values to others. Maybe the colleges and the pros didn't call, but the kids in California did. And now, I'm enjoying the competition, the camaraderie, the bands, the crowds, and all the pageantry of high school sports all over again.
This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
Cobb Mountain Artists will be presenting 2 large arts and crafts shows this coming holiday season. The first of these is the traditional Cobb Mountain Artists Christmas Show, which will be held at Twin Pine Casino the second weekend in November on the 11th and 12th. The second show will be at the Lake County Fairgrounds in Lakeport during the first weekend in December on the 2nd and 3rd. Artists interested in being vendors can contact Joanne Sharon at joannes@caseassociates.com or call 503-781-6548.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month, Tom Lincoln from Lincoln Levitt Insurance Agency. Lincoln Levitt Insurance Agency insures hundreds of local and out-of-county businesses, providing such coverage as fire liability, business auto, workers' comp, umbrella liability, director and officer liability, and group benefits. It also provides a full line of insurance products to local farmers and agribusiness owners. To request an insurance review, Tom and his staff are located at 650 North Main Street in Lakeport. They can be contacted at 263-7162 or through the website at lincolnlevitt.com.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, we're back.
We are back. There was a lot of information in the past, and still is, about non-steroidal anti-inflammatories elevating your blood pressure. And debate just continues about whether it's okay to use Celebrex in patients at a high cardiovascular risk. Now, why is that a question and the others aren't so much of a question is because this drug is categorized as a COX-2 inhibitor. And Vioxx, which was a COX-2 inhibitor, which was very effective as an anti-inflammatory, was pulled off the market because there was a cardiovascular risk and people were having an increased risk of heart attack and strokes. I, at that point, since I've had 4 back surgeries, was taking 800 milligrams of Celebrex a day. That's the maximum you can take. But I had taken all the steroids that I was allowed to take and was having side effects from the steroids and took Celebrex. As soon as that information came out, I went to my cardiologist and he did a complete workup on my heart, cardiac value risk, and found out that my heart was just fine. I still take 200 milligrams of Celebrex a day. And it may not be any higher risk than the other non-steroidal anti-inflammatories. A recent report suggests that similar rate of heart attack and stroke with Celebrex as is with naproxen or ibuprofen. So new evidence from the same study suggests that Celebrex and naproxen don't seem to increase blood pressure compared to 4 milligrams in systolic blood pressure with ibuprofen. But that only means that Celebrex or naproxen may have less effect on blood pressure than ibuprofen, not that is necessarily safe in patients with cardiovascular disease. Plus, those findings are mainly with Celebrex 100 milligrams twice a day, naproxen 500 milligrams twice a day, or ibuprofen 600 milligrams 3 times a day, which may not be enough for enough patients. Now, I take the same as 100 milligrams twice a day. And am I pain-free? Absolutely not, but it allows me to function, and my blood pressure is down to like 116 over 68, and so we continue limiting the dosages of people with cardiovascular risk with non-steroidal anti-inflammatories, but if it can't be avoided in high-risk patients, then we suggest leaning towards naproxen or Celebrex. And I actually was on naproxen for several years until it started eating up my stomach, and it didn't make me any smaller, by the way, but I got gastric ulcers. And so I went on Celebrex, and I haven't had any of that problem since. So I guess if you kind of check the risk factors, such as being over 65, prior ulcers, or taking steroids, it causes slightly fewer GI complications than naproxen or naproxen, as you want to call it generically. You want to use the lowest dose possible for the shortest duration. I think if you have a chronic problem, such as I do, my back's never going to heal. I'm still going to have the neuropathy and the pain that I had from the surgeries, but from just my back having a degenerative spine, that's never going to go away. So just a point of information for you, if you're on that, naproxen is, of course, a lot less expensive. We were talking about the donut hole before we had a break. You get into the donut hole rather quickly if you're on Celebrex, because it's much more expensive and it's not on people's formularies. So that's another reason to use naproxen or ibuprofen. But naproxen and Celebrex appear to be safer for cardiovascular risk, just the opposite of what we once thought. Now, I'll probably come back to you in 6 months and tell you just the opposite, but right now, for somebody who's been on Celebrex ever since they've been on the market, it has been very effective for me without the side effects. Recent wildfires and hurricanes and earthquakes has put the spotlight on how you need to weather natural disasters. I just read this morning where the fires in Santa Rosa and the wildfires in Sonoma County have been, and Lake and the 5 counties, are the most excessive, expensive, disastrous fires that we've ever had in the United States of America. So as I started talking to you, a few weeks ago about dangers of fires, not knowing that we were going to have one, we had certain policies in place when this happens, state laws, pharmacy practices, and common sense, people scrambling to get their meds filled if the disaster fits. I was talking to one of our pharmacies in Sebastopol, and Robert was having a difficult time getting emergency meds for a lot of his patients. Some were VA patients that he had no records on. Some were people he hadn't seen for 4 or 5 years. The government sent out rules to us that let us keep people from getting their maintenance medications. But if you update your med lists and taking pictures of your RX labels in case they're displaced. I never thought of doing that, but that's a great thing to do. If you need to use another pharmacy, which we have done since that happened, you will have it right in your phone. Many states, including California, allowed us to fill 3, 4s, and 5s, which are the lower controlled substance levels for an emergency, a 7 to a 30-day supply, if the prescriber can't be reached. And what they tell us to do is use our personal judgment. Are we going to put the patient in a stressful state by not filling his medication? If you're on a antidepressant, if you're on a blood pressure medication, if you're on a high cholesterol medication, are we putting your life at risk? That's a judgment call. That isn't anything that I, as a pharmacist or an owner of a pharmacy that employs pharmacists, can tell you. The pharmacist that's dispensing the drug has the right to make that decision. If the people don't have their RX labels or med lists, then we try contacting their regular pharmacy. Our difficulty in getting hold of physicians that were associated with the hospital, like Sutter and Kaiser, during this last fire, over half of those physicians lost their homes. Many of them lost their offices, and we weren't able to get a hold of their personal phone number or their office to override some of these. For early refill requests, we have a code that we can use that designates an override due to a disaster, and they allowed us to do that. And if you can't get certain meds due to supply issues, especially on an extended release, and if you have the immediate release tablet, it's a different med in the same class. We tell you exactly what to take to make up for that drug that was not available. So I'm sure some of you went through all of that, and hopefully all of you came out of it okay. There's always problems with these disasters, and we preach it and we talk about it, and we do all of this. And during the Valley Fire, when we were evacuated, I took pictures of everything but my medication. And wasn't a problem for me because I knew the meds that I took. And we were just warned to evacuate. We didn't have to, but I was all prepared, but not for that. So everybody has a cell phone now. Just take out your cell phone, lay your meds out there on the counter, take a picture, and you'll have it in your file, because I guarantee you most of you won't leave without your cell phone. I don't know if you know anybody that's been on dialysis, Paul. Have you ever?
I have not.
People, their kidneys aren't functioning,
Yeah.
and they have to pump out the waste because that's the kidney's job.
Mm-hmm.
And they will, if they have kidney disease, they will have an itching from that disease. And it drives you crazy because it's a chronic that affects about 40% of the people on dialysis, and it can lead to depression and poor sleep. And, excuse me, people have localized or widespread itching, probably related to the effects of the kidney disease on the nerves. And the inflammation and dry skin. And you can use, a lot of people will want to put alcohol on them, and alcohol just dries out the skin and makes you itch more. Use a moisturizer. I had somebody in yesterday that had that same problem, and to give them a cream that has either a hydrocortisone or some kind of a moisturizer in it 2 to 4 times a day. It may take a couple of weeks to work, and people that are on dialysis, because they go maybe 3 times a week, they're not very patient, and I don't blame them. They're miserable, and they want that to work. But a lot of people will take something like topical therapies that just aren't enough. Gabapentin sometimes, 100 milligrams. after each dialysis session and titrating it up if needed. Gabapentin is actually for neuropathy, and it was brought out for people who had seizures to eliminate the seizures, but it's used more for neuropathy now, and it can be used if you use it one small capsule after each dialysis session, it could be working. Some people don't tolerate gabapentin and may have success with another drug, but both can cause dizziness and sedation. You want to lean away from the thing we typically would lean to for a itching medication like diphenhydramine or Benadryl. Any perceived benefit is likely due to the sedating effects. It's not very effective in that kind of itching. Speaking of that, of Benadryl, I just had a patient yesterday who had made a poppy seed cake and then took a Benadryl about 15 minutes later and was throwing up, had severe gastrointestinal problems, sick for about a day and a half, and they asked me if there was an interaction between poppy seeds and diphenhydramine or Benadryl. And I had never heard of any, but what I had heard of were people that were taking a drug test and had taken poppy seeds. The poppy seeds have a small amount of opiate derivative in them, and it showed up on the screen as if they were taking an opiate, and they only took poppy seeds. That, by the way, is a frequent answer by people who are being tested for those kind of medications to tell them they'd had poppy seeds and it doesn't really pass the test. Alcohol and hand sanitizers, which you would think would work, may be actually drying you out more than helping you. So just be aware that that there are moisturizers out there that can help you, as well as gabapentin. Again, gabapentin requires a physician's prescription to treat you, but should be available without being much of a problem. I know a lot of people have gout, and there's going to be a new chronic gout medication that combines one drug with allopurinol. It's a combo that targets both the gout, which allopurinol decreases uric acid production, and lesinurad increases renal uric acid excretion. So you have one decreasing the uric acid production and another one getting rid of more of the toxic uric acid. So it helps about one more in 4 patients each that reach uric acid goals compared to 300 milligrams of allopurinol alone. That was another thing that I came across while I was in Salt Lake City. One of my family members had borderline gout and was taking 100 milligrams, and that wasn't doing it, and then the physician put him on 100 milligrams twice a day, and that wasn't quite doing it. And I said, why aren't you on the 300 milligram? You usually take it at bedtime. He said, I didn't know there was a 300 milligram tablet. And I said, there is, and frankly, if you just have a breakthrough occasionally, a 300 milligram a day at nighttime would probably be just as effective, and you wouldn't have the breakthrough. There's no proof that this combination drug is better at preventing gout flare-ups compared to about 300 milligrams a day of allopurinol alone. Right now, you know, it's the least expensive just to be on allopurinol. If they can't just tolerate allopurinol, then maybe the combination. You can titrate it up to, if they have a normal renal function, up to 800 milligrams a day if needed. But if the combination works, then keep in mind that there's something else out there. Also keep in mind that the probenecid, which is a drug called Benamid, is started at less than $3 a day, compared to about $12 a day for the combination. So 12 times 30 is $360 a month, opposed to $30 a month, but or no, $90 a month. But probenecid is dosed twice a day, and this other drug is dosed only once a day. So and there's more interactions with this drug than there can be if you're just taking one drug alone. So for anybody starting preventative gout medicine, we start them out adding colchicine or a low dose of naproxen for at least 6 months to prevent acute flare-ups. And it should be taken, the new drug should be taken only once a day, again, which is a reminder that it is, you're apt to be more compliant taking it than you would be otherwise, and that's something we need to be aware of when we have a chronic problem like that. And there is chronic gout. People have it all the time. One of our patients has chronic inflammatory gout, and that's because there's no feeling in the foot. And so when the foot hits something, even though they can't feel it, immediately the uric acid crystals start to form, and they get gout, and then they have to go on a routine to get rid of the acute inflammation. And if they don't, it just gets worse and worse. So I want to, again, to remind you about the flu vaccine, and about a lot of you have transferred your drugs to CVS. Your files have been sent to CVS, and CVS is telling some of you that you have to go there. You do not have to go there to get your new prescriptions. Just bring in your bottle, and we'll be able to get a hold of the physician or get a hold of CVS and get your prescriptions transferred. They have to transfer them. If we request them, and you request them, it may take a day, but they have all your files over there, so you do not have to. You can go to a pharmacy of choice. You don't have to come to us. You can go to Safeway, you can go to Walmart, or you can't go to Kmart anymore, but you can certainly come to us. I think you'll enjoy the experience, and we'd love to be filling your prescriptions for you, and we do have free delivery also. So I just want to make sure that you're reminded that there are other things available. Also want to remind you about your Medicare D. You have until just slightly over a month to convert your Medicare D or stay on the plan that you're on. We can help you with that. We can't sign you up with the plan, but we can certainly help you. And I've got 2 people to contact this afternoon who want me to go over their med plans with them and see, or you can go on Medicare.gov if you're fancy on a computer, and it really takes you step by step what to do. You need to know your Medicare A number, and you need to know the date you want on Medicare A to do that. And the flu vaccine clinic will be November 9th at our Hill Road store. I will tell you about it again next week, but I think it's from 12 to 2. We will try to get it on the internet too. My daughter just called me before I came on the air to help me remind it, so I wrote it down, and it's someplace, but I don't know where it is. So it's a week from tomorrow at the Hill Road store, and they'll be more than happy to catch you up. You don't need an appointment to come to us. You can come to us anytime you want, fill out a piece of document, and we'll take care of your prescription for you. You'll see a lot of people right now that are going into fast food stores and asking for if their chicken is raised without drugs. Consumers are increasingly demanding meat from animals that have been raised without antibiotics. The number of food companies, I know Foster Farm is one of those that says they're antibiotic free. For the third year in a row, Consumer Reports and 5 other consumer reports have graded the top 25 restaurants on antibiotic policies for meat and poultry. The number of chains that have taken at least some step to limit the use of antibiotics has almost tripled this year. 14 of the top 25 chains earned a passing grade. For the first time this year, Burger King, Dunkin' Donuts, Jack in the Box, KFC, and Starbucks. But all that's been in chicken production. So a quarter of all chicken produced in the U.S. is sold through fast food restaurants. So that area has significant impact. Of the chains, only Chipotle and Panera Bread currently serve no antibiotic beef and pork, as well as poultry. Subway also serves no antibiotic chicken and has a policy for meat. So be aware that things are changing rather rapidly in the food industry now and the soft drink industry, and you will see people question you about whether or not you should drink orange juice because it has too much sugar in it, whether you should not drink tomato juice because it has too much salt in it. And there's always going to be a reason for you not to eat or drink or do anything that is not healthy for you. When you get together for your Thanksgiving and Christmas, we kind of don't worry about that. We think it's time for everybody to be healthy and take a little break from not being able to eat some of these things and drink some of these things and get more involved with just having a good time rather than having a problem with what you're doing. So I was trying to find this documentation that told me, and here it is. 12 to 2, I was right. So that, I'm so proud of my memory, Paul.
That's fine.
That flu clinic at Hill Road is November 9th from 12 to 2. So make sure that you take advantage of that time, and again, you can get those any place. One little tidbit here about mind over pain. I don't know if any of you have been hypnotized before. I have. And just 15 minutes of hypnotic suggestion of mindful training cut pain by 30% for 1 hour in hospitalized patients in a recent study. Those authors say those strategies could offer patients a low-cost way to boost pain relief. Now, I don't know who does hypnotherapy that's an ethical healthcare provider, and I'm not excluding anybody because I just don't know anybody that does hypnotherapy. I had hypnotherapy when I came back from the war, and it worked very well to get me to accept the things that happened over there. So just put that in the back of your mind and pull it up when you're having pain. I'd like to remind you we're Northlake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192 or outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. See everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM KXPX Lakeport.